Mr. Speaker, to the bill.
To the bill.
I am a registered nurse and the first openly LGBTQ+ Black legislator in the 164-year history of our great state. Mr. Speaker, I am here today in support of the Reproductive Health and Access to Care Bill, House Bill 2002B. This bill would strengthen our state's protections around reproductive health services and improve access to gender-affirming care. As a member of the LGBTQ+ community, I want to stress that access to gender-affirming care that aligns with one's own physical body and their gender identity, is access to life-saving care. People who identify as transgender are 9 times more likely to attempt suicide than cisgender people, according to the National Center for Transgender Equality. However, we have seen that mental health improves dramatically with access to gender-affirming care. Passing the Reproductive Health and Access to Care Bill would move Oregon forward in the work to protect, strengthen, and expand equitable access to reproductive and gender-affirming care. In the 2022 election, Oregonians passed Measure 111, letting all of us at the legislature know that they want equitable access to health care for all. The passage of House Bill 2002B would be a great step in that direction, and it is one that we must take. Transgender Oregonians are still, to this day, forced to wait years for the care they need, and in some cases are unable to afford care that is not covered by their insurance plan. This bill would close those gaps in coverage under the Oregon Health Plan and by private insurers. This will save lives. Washington State enacted similar legislation in 2021, and to date, there has been very little fiscal impact to that state. This is not a burdening of the healthcare system. This is not a budget appropriation. This is expanding healthcare, specifically gender-affirming care, to all Oregonians regardless of how they identify or what insurance they have. Their lived experiences should not be up for debate. This is especially important considering what is happening across the country. As many states pass anti-abortion and anti-trans laws, including in neighboring Idaho, here in Oregon, we are protecting LGBTQ+ people and expanding gender-affirming care. Last week, Montana Representative Zoe Zephyr, a trans legislator, was barred from the House floor after speaking out about Montana Republicans' legislation that will ban gender-affirming care and harm countless trans and non-binary individuals. Representative Zephyr, I want you to know we see you and we hear you. Like Representative Zephyr, we believe people should have the choice to decide with their providers what is best for them. I'll add, for the record, that many medical organizations, including the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, the Endocrine Society, the American Medical Association, the American Psychological Association, and the American Psychiatric Association have published policy statements and guidelines on how to provide age-appropriate gender-affirming care. All of these medical societies find such care to be evidence-based and medically necessary. In addition to these major national medical organizations, here in Oregon, the Reproductive Health and Access to Care Bill is supported by major health organizations, including the Oregon Medical Association, Oregon Health and Sciences University, the Oregon Nurses Association, the Oregon Pediatric Society, the Oregon Academy of Family Physicians, and many, many more. I also want to talk as a registered nurse about why access to family planning and reproductive health services is critical. Oregon has done much to protect the right to choose, and in the wake of Roe versus Wade being overturned, it is essential that we strengthen those protections. We must protect providers who provide reproductive health care, such as birth control, family planning, and abortion, from civil and criminal liability and recrimination. especially from out-of-state parties and governments. As more and more states put forward draconian anti-abortion laws, Americans will be forced to travel to states like ours to undergo an abortion and receive much-needed reproductive care. Women who travel hundreds of miles for an abortion, especially when it is necessary in cases of non-viability, life endangerment, or ectopic pregnancy, face many hurdles. There's the cost of travel and lodging, the timing of the procedure, the time off from work and potential loss of pay, and the emotional and physical recovery. And that doesn't even factor in pain management and recovery in the cases of ectopic pregnancies, which are life-threatening, or the trauma and recovery if the pregnancy was the result of rape or incest. These people, along with doctors and nurses performing the abortion, should not be subject to criminal prosecution from other states, nor should they have to worry about such a possibility when they are already when they already have more than enough to contend with in the moment. It is our duty to protect both patients and providers from other states that seek to enforce overreaching laws. As a registered nurse with nearly 20 years of experience in various hospital units and settings, I have witnessed almost every conceivable medical scenario and crisis. I have cared for women recovering from an abortion that was necessary to save their life and consoled them through the devastation of losing a baby they so desperately wanted. I have attended women recovering after a rape and comforted them through the trauma and grief which ensues. No person who is raped should be forced to carry the child of their rapist. No one lightly chooses to undergo an abortion, and no one should have to fear jail on top of that hard decision. As other states around the country move to ban and restrict reproductive health and gender-affirming care, here in Oregon, we're working to support providers and patients and their families. Let's keep people safe and healthy. I urge a yes vote on House Bill 2002B. Thank you.